AED Familiarization Training Program created by HeartZap Services. Let's take a look at the heart structures and functions. The heart pumps oxygenated blood to the body, and then the body sends the deoxygenated blood back to the heart. The heart pumps the blood that is very low in oxygen back to the lungs to be reoxygenated. The lungs send the freshly oxygenated blood back to the heart to be circulated throughout the body again. There are electrical impulses that send a message to the muscles to contract. Together, they work in conjunction to pump oxygenated blood throughout the body. If the heart's electrical patterns are irregular, it may disrupt the regular pumping action of the heart. The abnormal electrical patterns are called arrhythmias. One of the arrhythmias is called ventricular fibrillation, which is essentially when the electrical activity is making the heart quiver. There's another arrhythmia called ventricular tachycardia, and that is essentially when the heart is beating too fast to be able to pump blood effectively throughout the body. This is where the AED comes into play. Defibrillation is required to reset the electrical activity of the heart. The AED is used to reset this activity. Survival rates in people who are experiencing cardiac arrest have been increasing over the years with the use of CPR and AEDs together. This is why AEDs are available for public use. With the use of an AED and high-quality CPR, the chance of survival increases to between 30 and 70%. With every minute delayed in using an AED and CPR, the casualty's chance of survival decreases to between 7 and 10%. The units that you have in your location are the Zoll AED Plus. They're very easy to use, reliable, and safe. All you have to do is press the on button and then follow the prompts. When the AED is turned on and the electrode pads are attached to the casualty, it will analyze the heart rhythm and notify the rescuer if shock is advised or no shock is advised. You only use an AED when the environment is safe. Do not use it on a severely injured casualty, and only attach an AED on a casualty that is unresponsive and not breathing normally. You will now see a video showing what is called a primary survey. It will give you the step-by-step procedure to start emergency scene management.
Look in the area for any kind of hazards. Check the casualty to see if they're unresponsive. If they do not respond, call 911. Open the airway, head tilt, chin lift. Listen for up to 5 seconds for breathing. If there's no breathing, start your compressions. Landmark at the lipple line, center of the chest. Compress at least 2 inches at a rate of 100 per minute. Notice she's standing right over top and bending from the waist using her upper body weight. Once your 30 compressions are done, open up the airway by a head tilt chin lift, pinch the nose, 2 breaths, 1 second in between. Continue your compressions. If it is not comfortable to do it in this manner, you can switch positions as long as you are doing adequate CPR.
HeartZap Services provides medical oversight for your AED program. AEDs are designed to determine the best treatment for a casualty. If the casualty is not breathing or is gasping or has labored breathing, the AED should be activated, and if safe, the electrode should be attached to the casualty's bare chest. The AED determines if a casualty needs a shock before starting each 2-minute interval of CPR between analysis. If no shock is needed, CPR will be recommended. If a shock is needed, the AED advises the user to establish scene safety and push the shock button before resuming CPR. The Zoll AED Plus semi-automatic has a 2-button operation. There's the on-off button and the shock button. There are other features that the Zoll AED has as well. There's a status indicator, the connector for the electrodes, and graphical icons with LED indicator lights to let you know what step the AED is at. There's an LCD display screen that will indicate what the AED is telling you, so that if you can't hear well, it will be displayed for you. It also tells you the amount of time the AED has been turned on as well as the number of shocks. The Zoll AED has a status indicator that is a green check mark. It tells you that the AED has done an internal automatic check. It does this every 7 days. The check ensures that the AED is ready for use, the batteries are good, and the electrode pads are attached. If you see a red X and hear a beeping noise from the AED, this indicates that the self-test has failed, which could mean new batteries are required, the electrodes are not attached, or the AED requires service due to a malfunctioning operating system. There are 10 lithium batteries at the back of the unit. While still in the package, the batteries have a shelf life of 10 years. But once they are put into the unit, they are good for 5 years. They can deliver up to 225 shocks. If a red X is displayed in the status indicator and the batteries are dead, there's a special way to open up the back of the unit to charge them. The next video will take you through the steps to do this.
To open up the battery compartment, use a coin or a pair of scissors with an edge. Insert it into the 2 slots and pry it open. Remove the cover, and there you'll have your 10 lithium batteries.
The CPR-D pads used by Zoll are unique as they are in one piece. They have a sensor in the middle called a puck. This sensor provides information about the depth of the CPR and the rate. They are very easy to use as they have pictures on them to identify how to place them onto the casualty. These pads are good for 5 years. The expiration date is on the yellow tab that sticks out of the cover. There is also an accessory kit that is attached to the packaging of the electrode pads, which includes a face shield, a set of gloves, scissors, a razor, a dry towel, and an alcohol wipe. The next video will show you how to open up the CPR AED pads, as there is a clear way to do it to make it easier.
To open up the CPR-D pads, tear along the red dotted line at the number 1. You may have to pull hard, and pull the pads out.
The Zoll AED cover can turn into what's called a PASS, or a passive airway support system. Put the lid right underneath the casualty's shoulders and allow the head to fall back into position. This allows the airway to remain open at all times. The next video will show you how to place the casualty on the PASS.
Use the cover of the AED as a passive airway support system. Place it right under the shoulders.
When the AED arrives, you need to ensure the area is safe. Turn the AED on immediately and remove the cover. Take the pads out and follow the prompts. Do not open the electrodes unless you have confirmed that the casualty is non-responsive and not breathing or showing signs of life. When you attach the electrodes, you need to make sure the chest is prepped properly. The gel on the pads requires very dry, clean skin. Excess hair needs to be removed. If the casualty is a female, you're going to remove the bra as well. Once the chest is prepared, place the pads in the proper position. The next video will show you how to prepare the casualty's chest, and the one after that will show you how to place the pads.
Using your AED prep kit, put the gloves on. Take the scissors, cut the shirt open, and expose the chest. If there is a bra, cut the bra too. Take the towel and dry the skin. If there's excess hair, use the razor to shave the hair off. The chest is now ready for the AED pads. Place the CPR-D pads on the chest according to the pictures. Pull the 2 tabs and ensure good adhesion of the gel to the skin.
Once the pads are in place and the AED is on, the AED will begin analysis immediately. It measures the electrical activity between the two pads and the heart and interprets if the heart is in a rhythm that needs to be shocked. When the AED is analyzing, make sure that no one is touching the casualty, as this will disrupt the analysis. Proceed as you are prompted by the AED. If the AED advises you to push the shock button, say the word clear, nice and loud to ensure no one is touching the casualty. If no shock is required, it will prompt you to start CPR and follow the prompts. The video you are about to see will have two rescuers working together on a rescue.
If you find somebody unconscious on the ground, look around and make sure there's no hazards. Check if they're responsive. If there's no response, have somebody call 911 and bring back an AED. Put your gloves on. Open up the airway with a head till chin lift. Listen for up to 5 seconds for any breathing. If there's no breathing, start compressions immediately. When the second person arrives with the AED, they will start preparations right away. Gloves on. You see here that they are working together. One continues CPR while the other one is preparing the AED. Use the scissors to expose the chest. Dry it off with the towel. If there's excess hair, use the razor to remove them. Put the pads on. And follow the prompts. As soon as the AED tells you not to touch the casualty, do not touch the casualty. Before pressing the shock button, ensure that there is nobody touching the casualty. Start compressions as soon as indicated. And continue to work together, 30 compressions to 2 breaths.
If you are successful in your rescue, the casualty may start breathing on their own. Always make sure to reassure the casualty. Let them know what happened and maintain an open airway by putting them into the recovery position. Monitor the casualty until EMS arrives, but do not remove the electrodes, as there is a chance the casualty may go back into cardiac arrest. You can turn off the AED. There are some special situations that change where you may place the electrodes. If the casualty has a pacemaker and it is under the area where the electrode pad would be, place the pad 3 to 4 centimeters away from the pacemaker. If you see any kind of medication skin patches, make sure you remove the patch wearing gloves so not to contaminate yourself, and clean the area with an alcohol wipe. If the casualty is pregnant, it is okay to use the AED. If the casualty is cold to the core, unresponsive, and not breathing, they are in a state of what is called hypothermia. This is the only instance where you will provide only one shock with the AED. Once you have done the one analysis where you are advised to shock or not shock, you can turn the AED unit off and continue with CPR until help arrives. The casualty in a hypothermic state must be warmed before anything can be done to help them. There are other safety concerns as well. Ensure you use personal protective equipment. For example, gloves. Avoid areas that have explosive or flammable agents. If the casualty is on snow, ice, or a damp surface, it is safe to use the AED. However, if they are in a large puddle, you can remove them from the puddle before using the AED. It is also safe to use the AED on a metal surface as long as the electrode itself is not touching the metal surface. Consult the manufacturer's recommendations if you have any other questions about safety concerns. If the AED fails, you can follow the prompts to troubleshoot. Turn the unit off, wait 10 seconds, and then turn the unit back on. Ensure the pads are connected correctly to the casualty's chest and that they are plugged in properly. If it is indicating the batteries are low and you have 10 lithium batteries on hand, you can change them. If there is an AED failure and you are not able to troubleshoot, proceed with the rescue as if an AED is not available to you, continuing with your CPR. It is important to maintain your AED. There are usually site coordinators that are in charge of this maintenance. They should receive additional training for this. It is recommended to check the AED once a month. At this time, the status indicator is checked, as is the expiration date for the batteries and electrodes. Maintenance also includes management of AED rescue event forms, data downloads and software updates, troubleshooting and technical support, and reordering of supplies. There is a maintenance record that is usually sent with the AED, which gives a checklist of things to look for. There is also an online due diligence program that is available. If there is an event, the data can be downloaded and will look something like this. It measures the electricity activity in the heart. It also records CPR compression rate and depth. It gives a good indication of how the rescue went from start to finish. Ready for Rescue is the training program available through HeartZap services. If you are interested in a CPR or first aid course, please visit the website listed. There is also an online blended learning first aid course that is available. The information about this is also available on the website. You can also call the main office at 1-866-764-8488. Thank you for watching this video, created to help familiarize you with the Zoll AED Plus semi-automatic unit.